On one of my segments, Ask Dr. Two. Listen, today, again, we've done some phenomenal stuff. I'm sitting here with one of my patients, Galen. He is one of the St. Louis Rams 2000 championship ring holders. He played for St. Louis Rams back with Kurt Warner back in those days. So we want to appreciate you, sir, for coming in and allowing us to do some work on you. So what we're going to talk about today, man, what's so crazy is how chronic infection can actually cause sometimes areas of your body to actually hurt, and how we can actually over here test some things, test that too, to see if it is causing your extremities, your foot, your knee, or some things, whatever, hurting. So what happened today, Galen came in today, we actually did some crowns on his mouth. He has a nice smile. We just got to deliver those crowns. And in the process of delivering those crowns, I noticed some chronic infection on one of his tooth because of the CBCT scan that we have. So if I look at the CBCT scan, you'll see right here, this little black area there, all of that is infection from a root canal that he's had for years ago. That infection has caused some areas of pain for him. He didn't know that, and probably his dentist, most of us wouldn't have not known that. So we did this procedure called a neurotherapy. Neurotherapy is where I go in, I put some anesthesia around certain areas around that particular tooth. And what the thing was, what I did was I asked him earlier if he had any kind of discomfort. It's a football player, so I already knew this man had some discomfort. You know what I'm saying? He played on that line, so I already really knew he had some discomfort. And sure enough, one of the problems he had was his knee. So I told him about what we were going to do. He was an unbeliever at first. You know what I'm saying? And so we actually did the work, and I just wanted for him to explain how he felt in 3 to 5 minutes of us doing what we did. All right, go ahead. Start.
So, I'm gonna try to give you a quick background of what I've done. I used to play professional football every day after practice, especially during tour days. The suggestion was always get into a hot tub or a cold tub to try to cool your knees down. I've always had knee problems as far as like tendonitis. I've had a couple of surgeries. My knees are always in pain. I can't use I always use an elliptical machine because a stair machine hurts my knees real bad. So today when I came in, he asked me about was I in any pain, and I told him yes. My right knee is always giving me problems as far as me trying to work out or try to stay in shape. So he told me about the pain that could come from my teeth or my root canal or whatever, and he put something on my tooth, and almost 3 or 4 seconds later, it felt like I'm gonna say 90% of my pain was gone. I couldn't believe it. I beforehand, I almost called the man a lie. And he proved me into a believer. He turned me into a believer.
That's right. Well, I just want to appreciate, because pain. Listen, this is not brand new, and it makes complete sense, right? I mean, when we talk about neurotherapy, nerves, right? Nerves all are attached. You only have 12 nerves in your head. We call cranial nerves, right? And everything is somewhat attached. So it actually makes sense why sometimes you can have something from here that can affect anything else. I don't know why we've gotten so away from the idea that medical and dental are the same, but in reality, for some reason, we've conditioned ourselves to feel like there's different. And by no means it's not. If you got chronic infection, that's chronic infection. That's a lot of infection that man has on his tooth. So it has to be something has to be happening somewhere else. And so just doing the testing that we did today, we were able to figure out that what's been causing him the discomfort. And look at him. I mean, this dude is, you already know this that's amazing. And I'm serious. For me to be able to start doing this stuff, man, it's a blessing for me. I am so excited that I'm learning this process for my patients and stuff like that, because at the end of the day, a lot of times people are getting surgery when they don't necessarily need it. There's a need for surgery. Don't let me ever tell you that. There's a need for root canals. There's a need for a lot of different things. But all I'm saying is when it becomes chronic infections, then sometimes that need is not necessarily what you think it is. It can also be other areas in your body that's causing that problem. So anyway, here's another proof. This is my second patient, the second day. We did another patient on Friday. So we did a video. If you want to check the video out, you probably can go on our website or hit me on Ask Dr. Tooth. Go on the website, Dentist in Manville, Dentist, DENTIST, Manville, MANVEL.com. My number is 832-637-4977. Hey man, stay blessed, stay Gucci. Hit me down below. Dr. Collins. Peace.